Hello and welcome to Fixing Business of Medicine with Kunal Jain. Thank you for watching and loving my show. Well, today we are going to talk about an effective marketing strategy and how you can achieve your plan despite of a fact that you're a small physician group or a solo physician, but you can still hire resources who can do and plan a better marketing strategy for you. Now the question is, do you really need marketing or not? Because when you talk to the physicians in this competitive environment, especially in today's environment, and if we are talking about Florida State, you see patients are there. It's just a matter of how you can reach out to them and find better patients so that you can have quality patients who really appreciate a quality care. Today, we have a guest in our show. Her name is Sonda Yunus. She is an effective marketing strategist. I know her for many, many months because one of her practices is our clients. She is an expert of her marketing and building a rural healthcare pediatrics practice. She has a show. She is a host, just like myself, and her show name is Revealed Business Success on YouTube. So today I'm going to welcome Sonda Yunus for an engaging conversation for next 15-20 minutes. Stay tuned. Hello, Sonda. Welcome to my show.
Thank you so much for having me.
Oh, absolutely. So I'm very impressed by Sonda Yunus and her marketing ideas because I have been working with one of the practices who happen to be our client. And the kind of marketing practices I see that practice has adopted in last many, many months to acquire patient growth in their medical practice is phenomenal. So that was one of the reasons I was so impressed that I requested Sonda to come on our show and share her wisdom with our clients and our prospects and people who are watching our show, what kind of ideas and strategies she has in her little brain where she can really, talk about it and share it with us. So thank you very much.
Of course.
And we will be talking about, I know you gave me some pointers, and then we would be asking those questions from you.
Sure.
So when we were discussing this, you mentioned something about Pareto principle, 80-20 rule. And I know in my last show also, one of the guests who came, and she also happened to mention that about 80-20 rule.
Yes.
So I want to pick up my conversation from that 80-20 rule and Pareto principle and ask you, what is this? I mean, just open it up, just share it with our client.
So the Pareto principle, 80-20 rule, is actually a law that happens in nature. So it can be applied to everything. So of course, I apply it to marketing.
Right.
And basically what it says is that 20% of your marketing efforts will generate 80% of new patients that you're going to get.
New patients, or if new business or new outcomes.
Or new business, exactly. For any business, it can apply. Now, you can also apply it to other things, such as, for example, 20% of your patients are going to bring 80% of your total revenue.
Wow. So the same set of patients, but you have to just find those 20%. You have to identify as a physician's office.
Yes.
You have to identify 20% of those patients who would be your patients for next 20 years or whatever the amount of time you want to practice. And what do you do with those 20%?
So basically, you want to identify, that's your ideal client,
Okay,
right?
okay.
You want to find clients that bring you the most lifetime value. So for example, as a pediatric practice, my father has a pediatric practice, as you know, for us, we see children from 0 to 21 years of age.
Right.
But the kids that are from newborn to 4 years of age are actually going to generate at least 80% of our revenue because they're the ones coming in, at 1 month, 2 months, 4 months, 6 months, 9 months. They have immunizations, right? They have to have dental varnish visits. And so they are getting the majority of their visits done from 0 to 4, right? So that's one reason we want to focus on that population. Another reason is because not only is this where the most frequency of visits happens, but if we get a kid at 0 or 1, we're going to see them until 21 years of age, right? Unless they move
Right.
or something happens.
Right.
Now, if we get a kid that's a new patient at 16, no matter how great of a job we do,
Exactly.
they're going to
Then
age out at
exactly.
21, right?
So your best bet is to keep when the patient is basically born in pediatrics,
Right.
you start giving them attention and paying attention. So for those kind of practices, and especially if you are in rural health, what is the best strategy you think it should be to do what?
Sure. Well, that's the million-dollar question,
Yeah.
right? So for a rural health clinic,
Right.
we do operate on volume.
Okay.
Especially since we are 90% Medicaid. So for us, it's not like we're getting these high reimbursements from private payers, So we get paid specifically a certain rate per visit, right? So for us, we have to see a higher volume of patients in order to cover our expenses and still make some kind of profit. Right?
Perfect.
A different type of practice, maybe a specialist practice that does higher cost procedures, they will not need to focus on the volume as much as they will need to focus on finding the clients that want to purchase or get their highest cost treatments, right? So now if I have one service that I'm selling as a specialist practice or really any business that I'm selling for X, and then I have another one that I'm selling for 10X.
Correct.
Of course, if I'm doing any sort of paid advertising or marketing,
right.
I want to push this one, right?
Correct.
Because I'm going to be spending the same marketing budget to either market this or this, but if I get a client for this, more profit.
So the first question comes to doctor's mind is, and then how would you identify that data? Where does that data resides? On the basis of which you can define your marketing strategy or pull some numbers and then say, hey, this is my research.
Yeah.
Who helps in that?
So data analytics is incredibly important. I've actually been working with a data analytics company. We've done several events for them.
Okay.
So they literally have teams that work on getting this raw data
From
putting it
our
so
practice management EMR?
Yes, for
Okay.
a medical practice.
So that's
it would
the
be from
first step.
EMR,
You gave
but
your-
not only.
Okay.
Not only.
Okay.
You may also need to look at your revenue statements, your other not projects, your other reports.
Like reimbursement
So-
by CPT codes? Okay.
That as well, yes. So that way you would be able to see which CPT codes are paying you the most, right? Then you would see what kind of client, what kind of patient is actually using those CPT codes the most. And then how do you get more of those?
So like this is very interesting because when we were doing billing, I found there is a specialized area called Wrapup billing.
Yes.
And that pays a certain incentives or maybe that money comes from the state
Yes.
to the medical practice, especially in rural healthcare, I think.
Specifically for rural.
Yes. Can you explain that, what it is and how they can make some more money if somebody is not doing that? And I think that is, it's like a gold mine kind of concept because state is incentivizing physicians whether they see the patients or not.
Here's
but,
the thing.
yeah.
It's not so much an incentive as it is just a part of being a rural healthcare clinic.
Okay.
Because the state has the Medicaid program, right? But the Medicaid program then has different MMA plans, which is like your Stay Well Medicaid, United Medicaid, all of those, right?
Right.
So now when we see a patient and that patient is, let's say, assigned to Stay Well,
Correct.
then we're going to bill Stay Well.
Correct.
Now, Stay Well is going to pay us the contracted rate, which will be
Perfect.
maybe $36.
That's true.
Right?
That's true.
But we have a flat rate, which we get for each encounter.
And that flat rate is determined by Medicaid
It's the
or a standard fee schedule.
It's a standard rate
schedule
for
for
all
your
rural
practice.
healthcare clinics in our area.
In your area.
Right.
And
So-
who decides that?
The state.
State.
The
Okay.
state,
Okay. Good.
Yeah, and then basically what happens is that when we submit the wraparound billing, we're saying, okay, here's how much we're supposed to get per visit. Here's how much we got.
Right.
Give us the difference.
Perfect.
And we do that for all the visits that we have, and then we have to submit it monthly, and then we get the difference from the state.
So especially in Medicaid environment, really. So but you are right that you have to identify the right patients, and you can get the data from EMR and practice management system. And so what do you think people who have more like commercial insurances, where their population are like moms who goes to malls, their populations are like single dads, or the kids who are in school. Under the observation of a caretaker or somebody, what's the best way to have some kind of marketing strategy to reach out to those areas where we see a potential where the kid or the children is not your prospect. The prospect is basically somebody who's a caretaker of their children.
And in a practice like a pediatric practice,
Right.
it's never the child, right? The child is never the patient. It's always
Correct.
going to be, most of the time, the
Right.
mom.
It's never the consumer, you call it. Like the
Right.
consumer is the mom.
Exactly,
Yeah.
exactly. You know, so we want to target moms. So
Right.
for example, when we are going to, for example, one of the strategies we use is paid social media ads, a lot
Right.
of paid Facebook ads, right?
The coupons work? Like coupons work? Publix kind of coupons? Can you do some kind?
Well, we're so regulated
Right.
in healthcare that I don't.
You cannot-
maybe if it's a cash.
If a cash, we
pay,
can do a coupon.
You know, practice.
Right.
Then absolutely, but definitely.
So if you're a cash-based practice in pediatrics, start releasing coupons. You can do that.
Exactly.
Yes.
Less than one.
Yeah.
But you know, I mean, groups are really the way, because you're not really going to go on Facebook and specifically target, okay, single dads, right?
Okay.
You can target men
Right.
with children
Correct.
in a specific location,
Perfect.
in a specific age range, right?
Right.
So that's going to be pretty much as good as you get there.
Yes.
Now, if you want to specifically focus on single dads,
Right.
I would say just do a search and see if there are any groups in your
Within
local
Facebook.
area, not within Facebook,
okay.
but also in your local community, because there are meetups.
So if you compare social media versus face-to-face networking, it's a big thing. You know, both are. I mean, for me, it works both way. You know, we have to go on social media for branding reasons, but we have to see people face-to-face to make some connections.
Right.
You know. So what do you think these doctors has the best bet when it comes to the networking?
Right.
Keeping in mind that they have a very, very limited time to
Right.
do certain activity, or they can hire somebody who can do the work.
Right. So I definitely promote both.
Okay.
You know, now my company is a live marketing company because we do focus on live, right? Real life
Anything
connections.
which is happening.
Exactly.
Okay.
So we want, our clients to realize that networking events or private events that you're doing at your practice are an amazing way to get out there.
Okay,
Or
and what
even
should
if-
they be doing? Like, let's say a physician, if let's say I'm engaged in 3 to 4 hours of networking event,
Yeah.
my time is precious to me. I'm not going to do that.
Well, and here's the thing, because you have to think about, okay, so your time is precious as a physician. Think about how much money am I receiving per hour, right? But then also, how much am I spending on other marketing expenses? So for
Right.
example, if you are doing a whole bunch of billboards, which are pretty costly,
Right.
you don't really know exactly who's seeing it, because it's literally anyone driving.
Correct, anybody
right?
who's,
So
yeah.
it's not a targeted audience.
That's true.
You're spending that money, which you could cut back on these expenses,
Right.
and instead invest a little bit of time,
Correct.
right? So of course you don't have time, but
Right.
would you rather trade a little bit of time or more money?
Or maybe can we see like these physicians, they go to the conferences, right? But they do more for education purposes. So what if they go into the networking event and they get a speaking opportunity?
That's the best.
So if that's the best thing. So if a physician has a skill set where you can share, talk, chat, and you do, because most of them, they talk to their patients all
course.
day.
Yes.
That's what they do. So if you can share some wisdom with other people, other doctors, go to the networking events where your patients are there, right?
Not even necessarily.
Oh, okay.
Not necessarily. Here's the thing. With networking, it doesn't have to be networking with specifically your ideal client. So I'm not going to go network with just moms.
Right.
And if I run into someone else, I'll be like, no, don't talk to me. I'm
Right.
here for the moms.
Okay.
Because as I always say, there can be referral partners that are
Right.
actually more lucrative to you in the long run than a patient, right?
Right.
So for example, pediatric practice again, we find a mom at a networking event. How many kids does she have, right?
That's true.
3 to 10.
Right.
10 if we're lucky.
And then she goes on Facebook and she suddenly finds an ad from that pediatric practice or my pediatric practice whom she met 15 minutes ago in a live event.
But that's not even the best outcome. The best outcome is if you find someone let's say a pediatric dentist
Right.
who also sees the same audience
Right.
that you see, who can be referring kids to you every single day because they see those patients.
Correct.
And then if that patient says, hey, do you know a good pediatrician?
Right.
Hey, here's a flyer,
Here's a flyer.
from the pediatrician
Correct.
that we have a good connection with.
Or he
right?
has a Facebook page. Go and search him.
Exactly,
Right.
exactly. So
Yes.
now we're creating a referral
So they both are
source.
going hand in hand, you're
Yes.
saying. You see, so it's all inclusive nowadays. It's
Yeah.
not just one thing, but it's very important to be in front of your patients, even in person. And
Yes.
it's also very important to create those referral networks
Right.
through word of mouth.
And
So,
another way to be in front of patients, which is kind of live but kind of not as live, but would be to do shows.
Right.
How many people are on YouTube?
come and speak on
How
my
many-
show.
Yeah,
Yes.
No, but how many people can actually create videos, even 1-2 minute videos
Correct.
of something that they're sharing with patients all the time anyways.
Educational
And they-
blurbs.
Exactly.
Instagram.
And they post it on, Instagram, Facebook, they post
Right,
it, right?
right.
And then that's another way where, okay, maybe you're not getting the public speaking engagements that you want, which you can also do a private event. There are companies that do that. But you can have videos that you're posting on your social media, and then people are still getting to see you
Right.
as a credible expert because
Yes.
they see you, they hear you. If they learn something from you, you're going to be top of mind.
Correct.
They're going to say, that's the expert I want my child to see, or I want to see. You know what I mean?
No, absolutely. So it's very important for you to understand that as a physician, the whole perspective is getting you better quality patients, people who are ready to pay, preferably cash, to your practice, because then right, if possible. If not, a good insurance companies or a commercial referrals. Now, and in order to do that, you have to go out and speak. You can do some kind of scheduling for your time, like twice a week or once a
Yeah, it
week, or
doesn't
maybe
have to be,
right.
right.
But it has to be a regular effort to do the marketing of your practice. That's fantastic. So that's very good to learn about these things, and I think a lot of our audience and physicians are going to learn or pick up some gems from this episode. And keep watching this episode. Sonda is going to be around. You can Facebook her, you can connect her through LinkedIn, and in this blog you're going to see some points where some of the ideas where we have taken the names of some brands which we are going to use or suggest you to use them. They would be all in the blog. So you would have an opportunity to read the blog and go into to those links and buy some of the services if you want. But Sonda lives in Ocala. She has a wonderful practice. Her company name is Leading Marketing Solutions. I would highly recommend her if anybody is looking for some marketing in Florida area. So thank you very much, Sonda.
Thank you so much,
and
Kunal.
thank you for the next show.